Hi, my name is Shelby Klein, and today I'm here to educate and inform you about what OCD is and how it has affected me personally. I was diagnosed with OCD in 2013, right before my senior year of high school. During this time, I was induced with severe stress and peak anxiety. OCD is a disorder which manifests itself through obsessive thoughts and compulsive behaviors. This disorder causes one to act on these obsessive thoughts with compulsive and repetitive behaviors, which can be dangerous if not monitored and treated correctly by a psychiatrist and therapist. So, how does one become diagnosed with OCD? I was personally diagnosed in summer of 2013 when I was evaluated on a pediatric psychiatry unit at the University of Iowa Hospitals and Clinics. No lab tests are used to diagnose OCD. However, the Statistical Manual of Mental Disorders 5th edition is used as a guideline compiled by the American Psychiatric Association when diagnosing OCD. Sometimes even short tests with circling correct answers on how you feel and evaluating them compared to compulsions will determine how severe one's OCD may be. So a quick overview of OCD. OCD consists of obsessions and compulsions. Obsessions are a pattern of unwanted thoughts and fears. Compulsions are urges to complete, driven, repetitive behaviors. Both of these will interfere with daily life and cause significant stress. Trying to ignore or stop these compulsions and obsessions will cause increased distress and anxiety. Some of the common signs and symptoms of OCD include examples of common themes within obsessions: contamination, fear of dirt, doubt of uncertainty, which is one I personally deal with on a daily basis, symmetry, aggressive and horrific thoughts, and unwanted thoughts, including aggression, sexual, or religious-based. I also deal with these on a day-to-day basis. Examples of common compulsions include washing and cleaning, checking multiple times, counting, which I deal with on a daily basis, as well as the checking, orderliness, following a strict routine, demanding reassurance. And in fact, demanding reassurance is the most struggle that I deal with on a day-to-day basis. These symptoms usually worsen during peak times of stress. For me, that was when I was deciding which school to attend and swim at. The biggest decision I had ever made in my personal life. So much so that it can become disabling, which it did for me, and that's why I was landed in the hospital. There are many things to look for when diagnosing or determining if someone has OCD. It is very important, if you are close with someone who suffers from OCD, that you become familiar with the common signs and symptoms of compulsions so that obsessions can be targeted directly. There are many ways to target these obsessions and compulsions, including medication management by a psychiatrist, therapy sessions by a psychologist. In fact, cognitive behavioral therapy is commonly used to combat OCD. This targets obsessions and limits compulsions. It is also important to monitor your self-behavior and your routine to see if there have been any changes, any significant changes. OCD is something that is real. It may seem irrational to many that do not have it, but it is no joke. It is very real to people like myself who deal with it on a day-to-day basis. When unsure if someone has OCD but have many signs and symptoms, treat them as if they do. It's very difficult for one who's already embarrassed by these thoughts and actions to put it out there or present it to someone in their life. So rather than prodding them and asking them for questions, just treat them like you would anyone else, but follow these signs and symptoms. If you believe you or a loved one should get help, reach out. Reach out to them as well as a hospital or doctor. Thank you.